I saved health insurance in the United States of America. Thank you. I didn't save it. They voted against it anyway.
Well, that was Jimmy Kimmel last night, back on the air after a break, and still talking about health care. He also addressed some of the flack that he's been getting.
And I would like to apologize for saying that children in America should have health care. It was insensitive.
It was all part of Kimmel's monologue from last week that has been getting a lot of attention.
You know, before 2014, if you were born with congenital heart disease like my son was, there was a good chance you'd never be able to get health insurance because you had a pre-existing condition. You were born with a pre-existing condition. And if your parents didn't have medical insurance, you might not live long enough to even get denied because of a pre-existing condition. If your baby is going to die, and it doesn't have to, it shouldn't matter how much money you make. I think that's something that, whether you're a Republican or a Democrat or something else, we all agree on that, right? I mean, we do. No parent should ever have to decide if they can afford to save their child's life. It just shouldn't happen. Not here.
He clearly tapped into something, because people with pre-existing conditions, they're concerned about what's going on, to put it mildly. So are parents of kids who have them. And the problem in New York, particularly acute, because so many children are in fact on Medicaid. Now, we have a few graphics that show you how many children would be impacted if Medicaid was cut as it's proposed to in Congress. Now, it's broken down by congressional district. The poorer the district, the higher the percentage, the more children would be impacted. Some districts as high as 70%, and all of them are in double digits at the minimum. And for more on all of this, we're joined by Dr. Edward Halperin. He is the Chancellor and CEO of New York's Medical College, based in Valhalla. Doctor, thank you very much.
Thanks for having me.
So to spare any suspense as to how you feel about it, you had said that the bill that was just voted on and passed in the House along party lines was voted on with a, quote, unique combination of ignorance and malignant intent. You're not fond of it. Why?
I think it will increase death rates from cancers which are common in women. I think it will disadvantage children's health care. It will disadvantage maternity health care. It is an attack on the fundamental belief that we are all members of the human family and have a right to life, liberty, and the pursuit of happiness, including our health.
With particular attention to hospitals, I know some people involved, and one of the things that came out of the vote last week was, forgetting what happens for the moment in the Senate, the uncertainty that this would inject in terms of the medical community, specifically hospitals, and how to treat. And not all hospitals are equal. Certain hospitals used to be not the place of last resort, but first resort for people that didn't have health insurance. And if we just look at New York for this conversation, whatever people think of Obamacare, it had a material impact of the ranks of the uninsured. And a lot of people didn't go straight since its passage to the ER. They went to go see a doctor. That would all get reversed and even arguably on steroids if, in fact, what went through the House became law.
Under the Affordable Care Act, which you just called Obamacare, the number of people on Medicaid in the United States went from a little over 51 million to now about 73 million. About 1/5 of Americans are on Medicaid, but about 1/3 of New Yorkers are on Medicaid. The number of New Yorkers on Medicaid went up enormously under the Affordable Care Act. There was also money in that bill which had improved reimbursement from Medicare to account for those people going to hospitals. This bill, which passed the House, guts Medicaid, does not restore Medicare funding for hospitals, and has the possibility of significantly devastating social safety net hospitals that take care of the poor and the marginalized.
If you could, try and put a human face on that, because everybody by now knows cuts are coming, potentially of a significant scope. But put a face on that, especially for a hospital that treats a lot of underprivileged patients. What happens if this were to become reality?
The bill defunds Planned Parenthood for a year. That means women won't get pap smears and won't get mammograms, and those are both malignancies in which the death rate is correlated with early diagnosis. Women will die from lack of early diagnosis. The city hospital system of New York, the public hospital system, stands to lose $750 million in Medicaid funding. The social safety net of people who go there for care will go away. I volunteer in the breast cancer clinic at Metropolitan Hospital in Harlem. Those are overwhelmingly women who are now covered under Medicaid who weren't. Care goes away. Here in Westchester, the Public Benefit Corporation Hospital, Westchester Medical Center, is highly dependent on this form of funding. It will be devastating.
Interesting, the trifecta of people who came out against it. You had from the medical associations that came out against it, the hospital association, even some of the insurance associations. Were you surprised how many insurers said, this is bad medicine, forget about what the Hippocratic Oath stands for, this just doesn't also make sense, even from a practical level? So many groups were united, at least in opposition, albeit for different reasons.
The bill was opposed by the American Medical Association, the bill was opposed by the American Cancer Society, the American Heart Association, most hospital associations, the American Association of Retired People, and some insurance companies. Now, the bill has a lot of boondoggles for the insurance industry. They can pay their executives more, they can use less money for health care and more for their stockholders making profits. They don't have to offer some people insurance. But some enlightened executives say, this is going to give the whole industry a black eye. We do not want to be perceived as an evil industry. We like to consider ourselves in the people business. We would rather not be labeled like the tobacco industry as hawking a bad product. Those enlightened executives realize eventually the American people will wake up and someone's going to take the hit for it, and they'd rather it not be them. But that, unfortunately, is a minority. They have certainly been lobbying their brains out to get lots of treats in this.
You know, Doctor, it was interesting for me when the passage of the ACA, Obamacare, happened. The administration, the then administration, I ever thought did a good job really explaining what it was. But even taking the politics out of this for a minute, I'm seeing people for the first time understanding, wait a minute, Medicaid isn't just for poor people. This impacts me. Or wait a second, pre-existing conditions, that's me now too. People, I think, are realizing now that they have it, and whether they appreciate what they're enjoying or not, how it's impacted them. I'm curious, from your world, is there kind of a fast-paced education, forget about re-education, education for the first time, what's actually going on and what might go away?
People who never had physicals are getting routine physical exams. People who didn't have mammograms, pap smears, blood pressure checks, examination for diabetes are getting it done. They're getting themselves treated. They feel better, and someone's about to take that away from them. I mean, the bill that passed the House allows employers over a certain size not to offer health insurance as an employee benefit. Well, that would be capitalism raw in the teeth, wouldn't it? Most of us get our insurance from employer health plans. That might go away from some of us. And as I said earlier, 1/3 of New Yorkers get their health coverage by Medicaid. In New York, on average, about 40% of children, in some counties, as you say, 70%. 50% of childbirths are paid for by Medicaid, about 2/3 of nursing home care. This is getting very personal, all right? Having a discussion about some exotic foreign policy in a faraway land might be an interesting intellectual exercise for two people reading their morning paper, but you're talking about taking away my and your and my kids and my grandkids' health coverage? You're talking about whether or not my next door neighbor might be more likely to die because they can't get their drugs in a timely fashion? Why? Oh, because the free market will take care of it. No, it won't. The free market in the United States had 200 years to take care of it. That's why we introduced health care reform. This is serious, this is personal, this is very dangerous stuff.
I certainly appreciate your time. There's so much more you get into. NIH getting defunded. It's so many different things, seemingly none of it good here. Dr. Halperin, I appreciate the time. Thank you.
Thanks for having me.
And we want you to be part of our conversation. We want to know what you think of the new bill that passed the House and is certainly engendering so much reaction. Plus, we also want to get your personal health care stories. Did you have problems because of pre-existing conditions before? Email us your thoughts to rfl@rnntv.com, or you can post them to our Facebook page. Just look for Richard French Live. All right, when we come back, more on the stunning firing late this afternoon of FBI Director James Comey. Stay with us. Well, it's the very latest reaction.